Dr. Stepovich, it was years ago when I first talked to you, and you explained to me the no tolerance bleeding policy in your office, something like that. Anyway, I might, remember that wrongly.
Yeah, we call it zero bleeding.
Zero bleeding, all right.
Zero bleeding.
Go in, explain it, and very importantly, explain how you achieve it, because it got to have something to do with dental hygiene, with brushing, and with whatever it may be. So go and give us a good overall, but rather specific point-by-point rundown what you do there.
With braces on the teeth, you have so many nooks and crannies to trap the spinach and whatever you're eating in there, and you don't want to go out in the public and open your mouth and show things on your braces. So most people want to clean their braces to have them look nice. However, the method that they use to clean the braces sometimes doesn't take care of the gum tissues as well as it should. And so we start in our office with the fact that gum tissue is not a tender tissue. God gave us gum tissue so when we eat food and it bounces off our teeth and hits the tissue, that it's a pleasant experience, that we're not in pain eating. And that tissue that's right next to your teeth is the same tissue that's on the palm of your hands and the bottom of your feet. It's callous tissue, and the more you exercise it, the stronger it gets. I always tell my patients who are getting started, do you remember when you were on the jungle gyms and you were having a lot of fun there and you got those blisters on your hands? And most of them say, yeah, I remember that. And then what happened after a while? Yeah, they went away and I had, my hands got real leathery. Well, you can do the same thing with your gum tissues. And once you do that, they're so tight around the teeth and no food gets underneath because you're exercising them and you're cleaning them. And the gum tissue just becomes really tight against the teeth. And if you talk to hygienists, they'll talk about stippling. You can see little dots on the gum tissue all around the teeth. That's where the little fibers are holding the gum tissue onto the bone. And you can see that. But if you don't exercise your gum tissues and really get them in shape, you don't see that. And the gum tissues are swollen because you're not getting all the food out from underneath the gum. The gum tissues don't meet the teeth at a right angle. They may have a little canal around there that's called a sulcus. And in that sulcus,
it's kind of like a carpet. It's kind of like a carpet. It doesn't necessarily lay 100% flat on the floor. It has a little bit of things where the chicken rest and the spaghetti rests can kind of like go in and start getting rotten, right?
Your teeth, the gum tissue does not meet the tooth at a right angle. It goes down and it has a little flap of tissue, and between the tooth and that flap of tissue, that's called the sulcus. And that sulcus has to be cleaned of anything that gets in there that would harbor bacteria, because your mouth is loaded with bacteria. And if you don't clean the sulcus, then the bacteria grow there and infect your gum tissues, and finally leads to recession of gum tissues and deep scaling and periodontal surgery. And so you don't want that to happen, and the only way you can do that is to brush the sulcus. And so
and by the way, is the brushing the sulcus, which is basically brushing the gums inside, outside, whichever way, but is that the method you described a few minutes ago as exercising the gums? As
yes, and the dialogue that goes with it in my office is, you hold the brush at right angles to the teeth, and you press as hard as you can, and you brush as hard as you can, as fast as you can, and you go over specifically in each quadrant. You divide the mouth into 4, and you brush in the back, and then the corner, and then the front in each quadrant. And if you do that as fast as you can, and spend about 3 or 4 brushings in each position, you can go over your teeth 4 times and finish the brushing in less than a minute. But you have exercised your gum tissues, you've cleaned everything fantastically, and when you do that, the braces automatically get cleaned. So you don't need a timer. It's not a timing situation. It's a method where the technique is holding the brush properly and using it properly. No circles, no up and down. It's just back and forth.
Okay, so go, even though you might not have a brush handy where there we are, but show us slowly the movement. You said number 1 in a right angle. Does that mean a 90 degree to your tooth? This is your tooth, and you're putting it on 90 degree?
Yes, that's right. I happen to have a brush here.
Oh my God! What is this? A dental office? What is it? What is this? A dental office or what? Okay.
Here's that brush.
Okay.
And that is definitely against the tooth. It's straight on, and you press the brush so that the bristles turn. They don't stay there. They turn against the tooth, and they turn and go into the sulcus.
Let's make sure the sulcus is what? So here's the tooth, and here's my gums, and they kind of like lay over it, right?
If this is the tooth,
yeah.
Okay. Here's the gum tissue.
Yeah.
It doesn't meet this way. It has a little ditch around the teeth.
Okay. All right. I got it. Yeah.
That's the sulcus.
So it meets this way, and is this still the tooth here? This is the tooth. This is where you bite. Oh, that's the root of the tooth. Okay. So that's the root. That's the top. Yeah. That's where you bite. Okay. Yeah. All right. So it meets like this, and the dirt gets stuck in between here, like in here, right?
Yeah. So you press the brush against there, with this down here. Yeah. And the brush now, you press it, and it turns on the teeth. It turns
right.
And then it gets down in the sulcus, and you go back and forth, and it goes in between your teeth and in the sulcus around the side of the tooth. And it really, if you do it properly, you don't have to floss.
Wow. Let me ask you here, because you're revolutionizing something here. Number 1, what you're explaining on how to brush, just to make sure that we all know here as laymen, is that only for when you have braces on it, or is that at any given time for a guy like me? Tonight when I go home, should I be brushing the way you just said, or is there a different method for me? I have no braces. You see, no braces.
Yeah. Well, that is exactly what we say in the office. If you brush this way, and when your braces come off, you keep brushing this way, and you will have all of your friends have deep scaling and root planing and have periodontal surgery, but you will not, because by brushing in this manner for the rest of your life, like you've been doing, that you were taught when you had the braces on, you will not have any problems with gum disease.
Wow. Now,
but you brush the same way.
Because you're not the first, I mean, my life, to a certain degree, revolves around dentists a fair amount, and frankly, what you just said not a single guy has ever told me. Now, I know all about being different because when I deal with people, be it on healthcare, I'm on just about anything, I'm always the only guy in the room who thinks a certain way, and I'm an opinionated guy. So I'm not trying to disagree with here because I wouldn't know. It's not my field. I'm telling you, everyone else tells me, or tells us, brush 45-degree angle,
yes.
Rotate, they do say use a soft brush. What are you saying on that? Do you use a soft brush for your purpose or a rather hard one? They do say actually the opposite. Don't push too hard because you're hurting your gums. They say those things. Now, they tell me for 58 years now, don't